my dear students. How are you all today? Hope you can say hale and healthy. Nowadays, to ask this question, you are healthy, has become a rare phenomena. Why I am asking this question is because today we are going to discuss about health and health insurance. You have already discussed about few of the topics relating to insurance. Now, in this topic, we are going to discuss about the health insurance. After the completion of this lecture, you should have the knowledge about the origin of health, levels of health care and determinants of health care. So, we are going to discuss only about health. Health, an important word in the life of every individual. When we have sound health, we can achieve any greatness in life. Am I right? We can do anything only when we are healthy. Healthy person is the confidence and happiness of every family. Only when we are healthy, we can be happy. If any one member of the family falls sick, the entire family collapses. Am I right? Imagine a family which leads a happy, they enjoy everything and prosperous life, where the head of the family, he meets with an accident. Imagine, as per doctor's advice, the family has to spend funds in lakhs to recover him. The only earning member of the family, he is now admitted in the hospital. Now, I need not explain you about the position of the family. The entire position of the family is changed now. But if they have insured that, there will not be any problem relating to funds at all. But the rest only God has to help them. What is meant by health here? A quote from a great Tamil poet we call Thirukural, Mihinum Kurayinum Noi Seyyum Noolor Vali Mudala Enniya Moonru. This was a Kural from Thirukural. The learned books count 3 with wind as first. Of these, as any one prevail or fail, 'twill cause disease. What is the meaning of this? It means if food and work are either excessive or deficient, sometimes we eat a lot, sometimes we don't eat anything. The 3 things enumerated by writers, flatulence, biliousness and phlegm, it will cause at least one disease to you. Health is defined as a state of physical, that is physically we should be fit, mental, we should have a calm life and social well-being in which disease and infirmity are absent. This is the definition which is given by the World Health Organization. See, we all know well that health is very important, but do we give importance to that? Health gives confidence for the individual, but in today's scenario, we get so many types of diseases for which we are in a position to spend a lot of money. When we want to go to hospital, our packet should be full. Simply to save our health, we have to spend most probably our entire wealth. Advancement in science and technology has brought about a revolutionary change in man's life. It has reduced the mortality rates and it has increased his lifespan, but at the same time has given rise to number of other ills. See, nowadays we are able to hear so many new diseases which our ancestors, they might not even heard about it. What is the cause for these diseases? Increasing pollution levels, especially in metros, the stress and strain which we have at our workplace, not only in workplace, nowadays at home also we have cutthroat competition taking its toll or some of the harsh realities. Another important factor which personally I feel is a reason for so many diseases is our food style. We eat any food without considering whether it is good or bad, and especially we eat it at any time as we prefer. The word stress, it again plays a major role for so many types of diseases. Even small children use the word stress for even small works to be done. We are able to hear words like, "Don't create tension for me, ma. I have to do a lot of work in the school itself." They are able to use the word tension nowadays. An individual going to his place of work has to spend long hours in queues, railway stations, bus stands, etc. If you take vehicle, inhaling the vehicular emissions of poisonous carbon monoxide gases affecting his health in the long run. Besides, accidents on roads, this has now become a common feature. Most probably we don't follow the traffic rules nowadays. Do you follow? Treatment for major illness or accidents can be unaffordable and may leave you poorer by thousands of rupees. It is especially worse when the patient needs specialized care. There is major illness, then they need some specialized care. We need to have a special attendant. Expenses are exorbitant and the situation leaves you mentally devastated. We can't be normal in those days. Also, burning a deep hole in your pocket. The family balance is affected. All those comforts of life, they have to give it up, and your family has to make up with bare minimum necessities which we are not used to. We have to bear with it in those situations. In such circumstances, the only solution available for us is health insurance. If you are insured, you can be a little bit peaceful. It will help you to tackle such situations with ease by providing you with timely and adequate medical care. We have heard of the saying, health is wealth. Have you ever tried to know what health actually means? What is the meaning? The word health was derived from the word health, which means soundness of the body. That is, our body should be good. In olden days, health was considered to be a divine gift, and illness was believed to have been caused due to the sins committed by the concerned person. Do you agree? It was Hippocrates who came up with the reasons behind illness. According to them, illness is caused due to various factors relating to, first one is environment, sanitation, personal hygiene and diets. The diets plays a major role in health. The Indian system of Ayurveda, you might have heard about the word Ayurveda and Ayurvedic medicine, which existed many centuries before Hippocrates, considered health as a delicate balance of 4 fluids. These 4 fluids are very important for health. Blood, which we know, yellow bile, black bile and the sphygm. And an imbalance of these fluids, any one, this causes ill health. Sushruta, he is considered to be the father of Indian medicine, is even credited with complex surgeries unknown to the West in those times. You might have heard about this Chanakya surgery. Over a period of time, modern medicine has evolved into a complex science, and the goal of this modern medicine is no longer mere treatment of sickness, but it includes prevention of disease. Prevention is better than cure, and promotion of quality of life. It is to be noted that Indian system of medicine like Ayurveda, they incorporated such a complete view of health from times which is immemorial. Now, what is the definition for health? According to this World Health Organization, we have heard the word World Health Organization as WHO. This health is a state of complete physical, mental and social well-being. That is, we should be able to move with people and not merely the absence of disease. It is not enough if we don't have disease alone. We should be healthy. Now let us try to understand what are the determinants of health. What are they? It is generally believed that the factors which determine the health of any individual are, first one, lifestyle factors. The first and foremost factor is the lifestyle factor. That is, how do we lead our life regularly? What we eat, what we do. Lifestyle factors are those which are mostly in the control of the individual concerned. For example, exercising and eating within limits. Do we exercise every day? It is actually a $1 million question. We find so many excuses. I feel sleepy, I have that work, to avoid exercising. Next, do we avoid worries? But we take everything to our head thinking that we alone can solve any problem, and the like, leading to good health and bad lifestyles and habits. This is exceptional, such as smoking, drug abuse and sedentary lifestyle with no exercise, leading to diseases. It may even lead to diseases like cancer, AIDS, hypertension and diabetes, to name a few alone I am saying here. Do you exercise every day? If not, start exercising from today so that you can have a good health. Doctors, they suggest that we should have the habit of walking every day to avoid disease. At least go for 20 minutes a day. Though the government plays a critical role in controlling or influencing such behavior, that is, example, punishing people with non-bailable imprisonment who abuse drugs, imposing high taxes on tobacco products, we should have the responsibility. That is what I say here, the personal responsibility of an individual that plays a deciding role in controlling diseases due to lifestyle factors. We should think about doing any activity before we indulge into it so that so many diseases can be avoided. The next factor, environmental factors. Safe drinking water, sanitation and nutrition are crucial to health, lack of which leads to serious health issues as seen all over the world, especially in developing countries. These communicable diseases like influenza and chicken pox, they are spread due to bad hygiene. The second one, diseases like malaria and dengue are spread due to bad environmental sanitation. We even don't close the water which we keep at home. While certain diseases are also caused due to environmental factors. For example, think about this, people who are working in certain manufacturing industries, they are prone to diseases related to occupational hazards, that is due to the workplace, such as this asbestos workers who are working in asbestos manufacturing, and also the diseases which cause due to lungs in coal mines. Now, let us see about the genetic factors. Diseases may be passed on from parents to children through genes. Such genetic factors result in differing health trends amongst the population spread across the globe based on race, geographical location and even communities. It is quite obvious that a country's social and economic progress depends on the health of its people. A healthy population not only provides productive workforce for economic activity, but also frees precious resources, which is all the more crucial for a developing country like India. At an individual level, ill health can cause loss of livelihood, inability to perform daily essential activities. They may not be able to do their own activities. So, we are in a position to help them and push people to poverty, and sometimes people even commit suicide. Thus, the world over, governments, they take measures to provide for health and well-being of their own people and ensuring access and affordability of health care for all citizens. Thus, spend on health care usually forms a significant part of every country's GDP. This poses a question as to whether different types of health care are required for different situations. Yes, we need it. Now, the next one what we are going to see about is the levels what we have in health care. Yes, we have levels of health care. Health care is nothing but a set of services, that is doctors, sisters and the lab technicians, everybody, provided by various agencies and providers including the government to promote, not only to promote, we have to maintain it and then we have to monitor how it is being progressed, or we should restore the health of the people. Health care to be effective, it should have certain features. The first one is appropriate to the needs of the people. What the people need, we should give them. It should be comprehensive, that is, in one place we should get everything. Adequate, we should have all the facilities. It should be easily available, that is, nearer to our location. Above all, the people should be able to afford, that is what we mean affordable. The health status of a person varies from person to person. It is neither feasible nor necessary to make the infrastructure available at same level for all types of health problems. It is not possible. We cannot have same level for all types of health problems. The health care facilities should be based upon the probability of the incidence of diseases for the population. For example, a person may get fever, cold, you can have cough, even you can have skin allergy. Many times a year, we can get it again and again. But think about the probability of a person suffering from hepatitis B, which is less as compared to cold and cough. We may not get regularly. In the same way, similarly, the probability of the same person suffering from a critical illness such as maybe heart disease or cancer, that is again less compared to hepatitis B. Hence, the need to set up the health care facilities in any area, whether it is a village, it is a district or a state, it will be based upon the various health care factors which we call it as indicators of that area. Maybe size of the population, depending upon the size the hospitals may increase. Death rate, that is again an important factor. Sickness rate, imagine in a city nobody is sick, then there is no need for any hospital, but it is not possible. Disability rate, social and mental health of the people, general nutritional status of the people, environmental factors such as if it is a mining area or an industrial area, the possible health care provided system, example, heart doctors may not be readily available in a village, but they are available in a district town. How much of health care system is likely to be used? Socio-economic factors such as affordability. This affordability plays a major role. Based on these factors, the government decides upon setting up of centers. They classify it as primary, secondary and tertiary health care and takes other measures to make appropriate health care affordable and accessible to the population. Government takes a lot of steps to protect public from diseases, but as individuals we should also take some effective steps to protect us from diseases. Apart from trying to protect us, we should be ready to spend for the diseases. If we get disease, we have to spend. Health insurance is that type of protection which we are having nowadays. What is this health insurance? Health insurance is an insurance that covers the whole or a part of the risk of a person incurring medical expenses, spreading the risk over a large number of persons. Now, what are the benefits of having this health insurance? There is a famous quote, without health insurance, getting sick or injured could mean going bankrupt, going without needed care, or even dying needlessly. We can hear that they are not able to spend, so they have lost the patient. We are really shocked to hear the fees charged by the doctors when we get admitted in the hospital. Recently, when one of my friend got his hand fractured, which was only a hairline fracture, the doctor charged 8,000 rupees for the POP alone. The key purpose of health insurance is to offer comprehensive medical coverage including day care procedure, this pre and post hospitalization. We need both, and the first one we need is the ambulance charges, domiciliary expenses and more. Health insurance protects your savings. You need not spend from your savings. You can just show the card from getting ruined in case of a serious health condition leading to hospitalization during policy period. Remember, the utility of a health cover of your medical insurance depends not only on its features but also on how well we are able to use them. Let us try to understand that in detail, the benefits. The first benefit is convalescence benefit, which we also known as recuperating or recovery benefit. Insurers take care of the insured's recovery expenses under this head, that is, they take the expenses. The benefit is given to cover supplementary costs that may arise due to hospitalization, such as loss of income. You may not get salary, so they give you supplementary. The insurers pays a lump sum amount in case of prolonged hospitalization, maybe from 7 to 10 days of the policy holder. In some policies, associated costs such as compassionate visits by family members, these are also covered in the benefits. The second one is the alternative treatment. See, we should find the alternative also. In recent years, the popularity of alternative treatment has increased manifold, that is many times. This has prompted many insurance companies to cover alternative treatments such as Ayurveda, homeopathy, Siddha, yoga, we can say a lot. For instance, one insurance, MediPrime, it covers alternative treatment up to 25,000 rupees. However, these insurers cover alternative treatments only if it takes place either in a government hospital or at an institute which should be recognized by the Quality Council of India and National Accreditation Board on Health. And the third benefit which we are going to see is the expenses related to organ donor. The cost of kidney transplant could range between rupees 3 lakhs and 5 lakhs. Having a health insurance in place ensures that you will not have to worry about your medical expenses before undergoing an organ transplant surgery. There are many organ transplant surgeries nowadays. Most general insurance companies cover organ transplant surgery as part of their regular health insurance plans. They have to do what is needed. Some insurers reimburse the entire cost, while others put a cap on these expenses or offer it as an add-on benefit. That is, they may say this bill cannot be accepted or like that. However, insurers cover only cost of surgery for harvesting the organ. That is, other costs such as donor's hospitalization, post-surgical complications and cost of screening are not covered by the insurers. That is, we don't take care of the donor. The fourth one is the domiciliary treatment. Many insurers have expanded their insurance cover to include treatment taken at home. We need to take care of them after coming back also under medical supervision. However, insurers have capped the amount and the number of days for which the benefit is available. For instance, there is a Heartbeat Silver policy which covers domiciliary treatment up to rupees 15,000 only, but per day the sisters charge 1000 rupees, but they will be able to give 15,000. Attendant allowance is the next one. Insurance companies offer attendant allowance to adults accompanying the insured at a hospital, one attendant for a patient, provided the insured is a child. In most cases, the number of days for which an insurance pays the attendant allowance is fixed. For instance, Insurance Happy Family Floater Health Insurance Plan offers attendant allowance of rupees 500 per day up to 10 days they give you. And the next benefit is the daily hospital cash allowance. Insurers offer additional financial protection to take care of expenses not covered under the policy, such as food and traveling. For instance, hospital daily cash policy offers daily cash benefit of up to 2000 per day for traveling and to have the food, etc. The amount goes up to rupees 4000 per day in case the patient is in ICU and accidental hospitalization. The next benefit is free health checkup, which is popular nowadays. Another benefit of health insurance policies offer free periodic health checkups to their policy holders after every 4 or 5 claim free years, that is, you have not claimed. Insurers offer cashless health checkup if tests are done at empaneled hospitals or centers, that is, the hospitals listed by the insurance companies. The next one, nowadays it is very popular, everybody concentrate on weight loss. We call it as bariatric surgeries. These bariatric surgeries are no longer considered a cosmetic weight loss procedure, but it is a life-saving technique for obese patients battling with medical conditions caused by or it may be related to weight. Many insurers cover these bariatric surgeries if done for medical purposes. They should have done it only for the purpose of medical. So, now you know more about benefits of health insurance policies. Do much more besides covering hospitalization expenses. Make sure to fully read the policy document to enjoy the maximum benefit out of it. So, in this session we have discussed about first the definition of health, and then what is health care, we discussed about it. Now, what are the levels of health care and also the determinants of health care. Hope you all might have understood it. Thank you. In the next session, we will try to understand types of health care and then factors affecting this health system in India and also how the evolution of this health insurance in India. Okay students, now in this session we have discussed about the first one we discussed about is the definition of health and then the health care, the levels of health care and also we saw about the determinants of health care. Hope you might have understood. In the next session, we will try to understand what are the types of health care, the factors affecting the health systems in India and also the evolution of health insurance in India.